Putting people first was the central theme in Edinburgh, as guests from across the country gathered for the communities as leaders for public health events.
The fact that Scotland is entering into a new period of public reform, health reform, is a huge opportunity for Scotland in terms of getting it right for the people and for the relevant communities.
A major period of public health reforms well underway, with the shared public health priorities being used to shape a collective response. And with the direction of travel now set, it's being argued that the time is right to create a new culture for health.
If you're in an organisation, how do you make it what you do and what you do for your staff? How do you support them to be healthy? How do you make sure that the things you do as an organisation create those environments? If you're in communities, how do you help communities be able to think about what are the major things that are maybe stopping that at the moment? So what needs to change in order to do that?
This comes ahead of the launch of Public Health Scotland in April 2020, with the new national organisation tasked with helping to drive change at a local level.
I think it does have to happen, and I think it's a big challenge for public health reform, because what we're talking about here is devolving power, responsibility, budgets to a much more local level, where the public sector maybe acts more as the support mechanism for health care at a much more local level. So yeah, that is a big challenge, that is a change, but I think that transformational change is needed.
Partners across the country are now coming together to tackle public health challenges and drive down inequalities, to create services which truly meet the needs of Scotland's communities.